Association, just shedding more light on that. We want to cross over to the health sector now, which is on edge on a day that 866 people have tested positive for COVID-19 in Kenya. Now, nurses and clinical officers have announced that they are ready to begin their strike on Monday. Now, as Mark Namaswa reports, the medics are lamenting on failure by the government to supply them with COVID-19 protection kits, health insurance cover, and salaries for those under universal health coverage.
Healthcare workers in a short commemoration of fallen medic Victor Kipngetich from Nandi, who becomes the 9th clinical officer to die of COVID-19 related complications. They say a death such as this is among key reasons making them head for the streets.
We are the people who are exposed to infection, and yet we are mingling with Kenyans every day.
The nurses and clinical officers say these are dangerous times for them, working without risk allowances, sometimes without salaries and no medical cover. Kipngetich, for instance, left behind a 2 million shillings medical bill, yet medics, for instance, those with underlying health issues, remain on the front lines.
To exempt people with pre-existing diseases, people who are aged and pregnant from duty. What is so difficult?
Medics say it beats logic for them going without personal protective kits, yet the Kenya Medical Supplies Authority KEMSA warehouses are filled to the brim with medical equipment such as masks and personal protective kits. KEMSA is instead viewed as a bastion of procurement scandals and cannot supply health centers with PPEs without the Ministry of Health approval.
KEMSA is telling us that they have not received any authorization, so we will follow up with the ministry.
Clinical officers and nurses now join doctors who sounded a strike alarm call earlier in the week. From Monday, 7th December, they promised to be nowhere near their places of work.
What was given to the government did not mean anything to them, and hence the government is planning to go on strike.
Unless this matter is comprehensively addressed, on 7th there will be no doctor in the facilities.
For now, unless government intervenes before Sunday at midnight, next week will be tough to those who fall ill. Mark Namaswa, KTN News.
Away from health, President Uhuru Kenyatta is tonight talking tough against foreign interference in Kenyan affairs.